This is Volusia Today, a public information radio program brought to you by the County of Volusia.
Good morning and welcome to Volusia Today. My name is Michael Ryan. I am the Volusia County Communications Director, and I'm here with my co-host Dave. Dave, good morning.
Good morning, sir. How you doing?
Dave, I'm not too bad. Dave, are you communications specialist? What's your official title?
Just Volusia County Communications.
Period. That's it. Let's end it there. You're just Volusia County Communications.
Whatever needs to be done, I try to help out and get it done.
David, well, what does that mean? Tell me what you do every day. I don't. You're never in the office. I don't know what you do.
I do a lot of video stuff, do social media stuff, news releases, events, basically messaging. If you see a piece of messaging out there, there's a chance I might be involved with it. Anything coming out of the county, I might have played a part in it. We're a strong team, so we usually everybody's got a little hand in it, and we bounce a lot of things around. So I can't take any credit for anything individually, but we try to get a lot of good information out to the people as a team in general. Volusia County Community Information.
That was a very PR answer.
Well, it's the truth, though.
You answered for like a full minute and gave me no content. Nice job. So, we have a couple of special guests here today. Dave, before we get to them, let's talk a little bit about maybe some Volusia County news. You're my beach guy. What does the beach look like this weekend?
So it's going to be, we've been seeing this a lot, I would say almost the past month. We still have the high surf and we still have the dangerous rip currents at the beach. The weather's supposed to be a little nicer this weekend. We're supposed to see a little temperature drop, but the days are supposed to still be around 80 or mid 80s. So we might see more people at the beach. If you're headed down to the beach, make sure to swim in front of a staff lifeguard tower. And if you do decide to go in the water, stay in waist deep water. Make sure you can firmly grasp the bottom with your feet. And then one other tidbit is we have late afternoon, 2-3 o'clock high tides. Beach driving may be impacted during those high tides. A couple hours before and a couple hours after, beach driving may be closed because the tides have been high. We did have the super high tides in the full moon last week, so the beach driving may be impacted. If you are headed down there, download the Volusia Beaches app. It'll give you all the information you need, staff lifeguard tower locations, what ramps are open, and a lot of other helpful information. We got live beach cams so you can get a look at the beach, and that's on Volusia Beaches YouTube channel and on the app. So it's a great resource if you're headed down to the beach, and it'll give you all that safety information you need. It'll tell you what flags we're flying, what the conditions are. It's just a great resource. It's everything you need to know. Download the Volusia Beaches app if you're headed down there for sure.
Yeah, that's good advice. Good advice. You know what I do love? October in Florida at the beach, right? It is one of the best months to hit the beach.
It is. Fishing's good. Waves are good. It's my favorite time of the year. Weather's good.
Kids are in school. Tourists are gone. Let's be real, right? We get our beach back for a little bit.
That's it.
Not too long. In other exciting news, we had a county council meeting this week. Talked a little bit about the State of the County event, and we are going to work to move that to the west side of the county.
Oh, that's exciting.
And our this is nowhere near as exciting as the beach news, but we also adopted our budget for 2024 that has a lot of good things in it, where they eliminated the a tax for the residents on the communications tax, which is a big deal.
Yep. I saw that.
And held the line on most of the other millages, if I remember correctly. So that's a big moment in time for us to now all the departments and stuff get ready to fund everything they're going to do, the projects and the services for next year. So that was a big deal for us in county government this week. We have special guests, and let's not make you guys wait any longer. Thank you for joining us. Our guests today are with Mosquito Control. What's the official name?
Volusia County Mosquito Control. We are also the East Volusia Mosquito Control District.
Okay. So, tell me, and what's your name?
My name is Miranda Tressler. I'm the Environmental Program Manager.
Miranda, nice to meet you. Thank you for being here today.
Thank you for having me here, Michael. Hi, Dave.
Who did you bring with you?
With me is one of my partners from Department of Health, Benjamin Youngst, and we're going to talk a little bit about our collaboration and how Mosquito Control and Department of Health work together to fight the bite in Volusia County.
Okay. So I'm still fairly a newbie to Florida. I moved here in 2012, about 10, 11, 12 years ago, something like that. When I first got here, I got my first tax bill, and on it, there was a mosquito control district tax, right? And I'm like, what is this? I don't know. I've never seen that before, right? Coming from where I came from. So help me understand. What does that tax go to? What do you guys do every day?
So if you live on the east side of Volusia County, you likely see on your tax bill a tax that goes directly to the East Volusia Mosquito Control District, and that funds our program, which is a full integrated pest management program. We'll get into some of the details later in the show. But essentially, we're here monitoring the mosquito populations and the disease activity in Volusia County, and then planning the appropriate treatment operations based on that data to protect public health in Volusia County.
Wow, you've said that before, haven't you?
A couple times.
Yeah, that's not your first time. What does that mean on a day-to-day basis? Like, do you guys get in cars and drive around to look at mosquitoes? Do you spray? Do you helicopters?
We have been referred to as hillbillies that drive trucks around at night, but I can assure you that is not true.
Well, and never on this show would we refer to you as that.
We are a very robust, actually scientific program. We have a great team that works day and night. So during the day, we're out and about monitoring mosquito populations through traps. We're looking at disease activity in sentinel chickens, conducting larviciding, targeting those baby mosquitoes in the water, educating citizens at different events, and then at night we are out there with the treatment trucks treating areas where adult mosquito populations have hit certain thresholds.
Okay. Did you say sentinel chicken?
Chickens. We have about 125 chickens that are employees of Volusia County Mosquito Control.
Dave,
they get the benefits and everything.
You play an instrument, Dave?
No.
You play guitar. You look like a guitar player.
I'm not a guitar player.
Right.
I wish.
We're gonna start a band and we're gonna call it Sentinel Chicken.
Oh,
I
that's
love
pretty
that.
good.
Yeah,
like
it's gonna be really, really cool. So, if I see mosquitoes in my area, what do I do? Do I call you?
Yeah, so you can go on our website, volusia.org/mosquito. We have an online request form. So if you live inside the district, you can submit requests directly to us on that online form. You can also give us a call, but you can do it 24/7 online. If you live on the west side of the county, it's a little bit different because our service areas can vary. There's information on our website about who to call if you live inside the city limits, like Deltona, DeBary, Lake Helen, Pearson. If you live inside some of those city limits, you'll have to report your mosquito problems to your city representative.
Okay.
When I was driving in this morning, I was thinking, I've been over to your shop. You got a lab. It's very scientific. Y'all are straight up scientists, microscopes, the whole works, lab coats. You got the whole thing going on over there. But I was driving this morning and I was like, they're kind of like weather forecasters for mosquitoes as well, because you're out there monitoring the situation, capturing mosquitoes, monitoring diseases and all that. And then and then with all the recent rain, right? What is the forecast for mosquitoes right now? What's going on?
So the mosquito forecast is high. One of the things that I brought with me today is actually a trap collection. So this is probably close to about 1,000 mosquitoes that I caught in this trap. And these are very aggressive floodwater biting mosquitoes that came off because of the recent rainfalls. So
and they're alive. And she's going to let them go.
They're moving around. I did not see that till just now.
Yeah, you should put your ear up to them and listen to them.
No,
buzz.
I'm good.
They're pretty buzzy.
No, that's cool.
They're excited. But mosquito forecast is high. We're actively out treating the standing water through larviciding practices. And then at night, we're running those treatment trucks in areas where populations have hit thresholds and they need to be treated. Our inspectors, they've just been really working hard all week, day and night, to treat these mosquitoes and try to minimize the impacts from this widespread rainfall.
Go ahead. About a week ago, or maybe it was 2 weeks ago now, I gave a shout out to Mosquito Control. My buddy called me all excited about the job y'all had done. I texted him yesterday, letting him know you were going to be on the radio. And he texted me this morning. He's like, I was up, he just had a baby. And he was up feeding the baby at 3 a.m. in the morning. He's like, Dave, I heard a mosquito truck out there spraying last night at 3 a.m. Y'all work all hours of the night, all the time?
All the time, just whenever operations are needed.
And it's not just y'all, right? Like, we can do something to the residents to help with the mosquito population, correct?
The public can help us drastically. So one of the things that is a major problem are, they're called domestic mosquitoes or container mosquitoes. They actually breed in small amounts of water in containers around people's homes. Anything from bird baths, buckets, plant saucers, tarps, boats, kiddie pools, yard ornaments, anything holding small amounts of water in your yard can actually produce a significant amount of mosquitoes that have a very short flight range and will stay around your yard and your neighbor's yard. We need the public's help to go around and dump out that standing water at least once a week to break the life cycle and reduce these domestic type mosquitoes.
And you'd be surprised at what you can find in your yard that's holding water. You just said a bottle cap can produce mosquitoes. So do that. Go out in your yard, right after this episode. Why not? And just see what you have in your other home water and dump it out.
My classic saying is to look up, down, and all around. We find the strangest things breeding mosquitoes because mosquitoes are very crafty and they can find small cryptic areas of standing water. Even on beachside, those big conch shells that people like to have in their yard, we find those breeding domestic mosquitoes. They need to be emptied out or stored upside down so they can't store water.
Plants. What are those plants called?
Bromeliads.
Bromeliads, yeah. Those for sure too. So, Jonathan, I feel bad we haven't even brought you in the conversation yet.
Welcome to the show.
Yeah, well,
Thank you so much.
15 minutes in.
Okay.
How does this work? How does mosquito control and the health department work together?
So first, my name is Benjamin Youngston with the Department of Health, Volusia County. How we work together is in multiple formats. We have a surveillance system and we have a rapid response system. Surveillance system includes the sentinel chickens we talked about. It also includes periodic mosquito pool testing, which Mosquito Control also does. Then it also includes our case reports. As a public health agency, physicians, doctors' offices, hospitals report communicable diseases to us that for investigation. We sometimes get them based on confirmed cases, probable cases, suspect cases, or even where they're just thinking it could possibly be a case of reportable illness, including arboviruses. We also have a syndromic surveillance system, which hospitals, ED, emergency departments, freestanding emergency departments, and urgent care centers report into. And it includes chief complaints and diagnosis of the clients. And if they you can use a keyword search for that. And if, let's say, somebody says dengue fever or chikungunya or West Nile virus or arbovirus or malaria or any of the other mosquito-borne illnesses, we get the hit when we do our surveillance, and then we contact the facility to get information to see if it was an error or if it really is a case. We have travel associated cases, and of course the worst case scenario is locally acquired, which we do our best to prevent. Once we have a suspect case, we notify Mosquito Control for them to do their thing in and around where the case resides and or works, to reduce the mosquito populations in that area based on what disease we're responding to. In addition to that, we also look, like I mentioned, we look at sentinel chicken levels. We look at what the background levels are, and then what the current levels are. And if one area exceeds it by a certain amount, it would trigger an alert or an advisory. Or if the whole county-wide exceeds it by a smaller amount, it would trigger an alert or advisory. And if we have locally acquired cases, that also triggers alerts or advisories. And when we issue an alert or an advisory, we do it with Mosquito Control, and that's when we notify the population that we have something really unusual, and that they have to take. Everybody should always be taking precautions against mosquitoes, because they can transmit illness even without an alert or advisory. But especially when there is one, that's when you take special precautions to try and avoid mosquito bites.
I'm not going to lie, you guys are two of the most terrifying subjects we've had in those two chairs. Like, I don't know if it's the alert and advisory precaution.
Chikungunya got me.
Yeah,
that's chikungunya. I'm like, whoa.
Like, we had DeBerry Hall on here 2 weeks ago, and they were talking about it being haunted, and they showed us a picture of it, like, literally being haunted. They had nothing on you guys. This is like watching a scary movie. You know what? That's probably a good segue into a commercial. Let's take a break, and we're going to come back and talk more about mosquitoes.
Make the most of your day at the beach. Download the Volusia County Beaches app today. Sign up for real-time notifications on vehicle ramp openings and closings. Find staffed lifeguard towers. Get updates on tides and beach conditions, plus off-beach parking and coastal parks info. Volusia County Beaches app is available for your smart devices at the App Store and Google Play.
We're back. I'm David Hunt, along with Michael Ryan, and you're listening to Volusia Today, a public information program brought to you by the County of Volusia. We have Mosquito Control in the studio and the health department. We talked a little bit about mosquitoes, the forecast, what we're dealing with right now. Benjamin just hit us with a lot of information, like you were saying. Alerts, advisories.
I'm coming over and helping you with all those bottle caps in your front yard. Yeah,
Yeah. We hope everybody went and
I'm
dumped
definitely
everything
going
in
home
the
and
yard.
looking at my house.
You should.
Sure.
It's pretty crazy what you'll find for sure. What you said some names, some viruses that are in our area. How are those transmitted? Can those be passed from person to person, or how does this virus travel in our community?
The first thing I'll say is we currently are not under any advisory or
That's good
alert.
news.
That's
I feel so much better now.
In addition, some of the ones you were talking about right now, dengue or chikungunya, we don't have any evidence we have any of that in our community right now. But basically, what we do is we have a surveillance system, and we look for imported cases of these illnesses. And you guys you may be aware, earlier this year we actually had locally acquired malaria in Florida over on the west side. We didn't have any here, thankfully, but that's a very unusual event. But it starts the same way. You have somebody that visits a country where these diseases are prevalent in the mosquito populations. They get exposed, they get mosquito bites. They return back home. And if we can respond quickly enough, we notify mosquito control. They take care of the mosquito populations in and around the case. And like the mosquito can't spread the illness after it's dead. So that's basically how we try to respond. We have somebody that maybe was exposed somewhere else. They come here. If we get notified fast enough, we can get the mosquito populations reduced substantially to substantially minimize the risk of locally acquired infections. And that's really what the gist of the program is it's rapid identification and then rapid response for control. And control also includes the cases. The people that are, our side of it is we contact the people that have whatever mosquito-borne illness we're referring to, and we advise them to stay indoors. If they go outside, cover up, use mosquito repellent, and at all costs avoid getting bit by our local mosquito populations.
Let me see if I understand this correctly. Somebody flies in, and they have, let's say, malaria. A mosquito, our local mosquito that we have here, could bite that person, and then that one local mosquito is then carrying the malaria. Is that correct?
That's correct, and I didn't answer your question. It's not spread person to person.
Okay.
That's part of your question.
Okay.
But that is how it works. So the person the individual has the mosquito-borne illness. Our local mosquitoes that don't have the virus yet bite the individual that does have it, and then they carry it as well. Then they bite the next person, and they can transmit it to the next person.
So I was listening to a podcast the other day about mosquitoes, ironically, 'cause that's what I do on the weekends. and they said that the mosquito is the deadliest animal on the planet. That it is, and not as a podcast, but it's responsible for more deaths than any other animal. Is that accurate?
That's true.
That
I
is
actually
true.
have a little keychain, and it's like a shark keychain, and it says that fact on the shark because most people think like sharks, tigers, like very dangerous animals, like that's got to be the most dangerous animal, but the most dangerous animal is actually very tiny.
Yeah, that's what we're the next shark bite victim we get that we have to deal. We're just hey man, at least it wasn't a mosquito.
Right.
You're going to be fine. At least it was not a mosquito. Well, the podcast also said that we're in I don't even know and I know you said there's no current alerts right now here.
Correct.
We're not under like an immediate threat or anything. I feel much better knowing that. But they said that there is like this resurgence, like Dave was talking about the prediction of the weather and all that stuff. The population is super high, like worldwide right now, or what does it look like?
Mosquito populations?
Yeah.
So mosquito populations vary widely depending on the area and then depending on the environmental conditions. So I've been at mosquito control for about 10 years now, and every year is different in Volusia County as far as how many mosquitoes we have, what times of the years we have those mosquitoes, what species of mosquitoes we have, and then what corresponding virus activity we have. It just varies greatly, and that's what's so great about our partnership with Department of Health is that we're continuously monitoring these situations so that we can identify them early on and then act to prevent it to causing harm to the communities.
That's the thing about mosquito control. You might see the trucks driving around, you might doing that, but or might see them the helicopter flying around. But at the end of the day, it's a health risk. Like that's the That's the main focus, is the health, right?
The health of our residents and the tourism in Volusia County. This is a highly traveled to area. We want to protect our residents, and then we also want to keep this safe for the visitors who come here for all the events we have at like the Speedway or Biketoberfest, Bike Week. People are coming for spring break to the beaches. Like, we don't want them to be unnecessarily exposed to mosquito-borne illnesses. We want people to stay safe, stay healthy, and then come back here and visit.
And once again, so we can do something ourselves. Each one of us can do something as well. We can protect ourselves. So now that you have gone out in your yard and dumped everything out, now what can people do? Let's say they're going to be outside or go camping. What can people do to protect themselves from mosquitoes?
The number one recommendation to protect yourself is to wear an EPA-approved repellent. So any type of repellent that has active ingredients like DEET or oil of lemon eucalyptus or picaridin. We also have a search tool on our website, volusia.org/mosquito, that can help you find some of those EPA-approved repellents. Read the directions on the repellent. Sometimes they say to apply in a certain manner or reapply after a certain amount of time, or if you're going to be putting it on your face, to put it on your hands first and then put it on your face. Make sure you're reading the instructions on that product and following the instructions. But people need to take actions to protect themselves. We only have so many resources at Volusia County Mosquito Control. We're out there trying to reduce those populations, but mosquito-borne illness is real. We do have virus that actively circulates in our communities, especially in the bird populations like West Nile virus and Eastern equine encephalitis. So make sure if you're going to be outside, especially during peak times like dusk and dawn, you're wearing the appropriate clothing, covering up your skin if possible, and then wearing that EPA-approved repellent. And if you have a major mosquito problem, give us a request on our website so we can follow up on it.
So, Miranda, God, oh my gosh, every time you talk, I just have more questions. So what is a non-EPA repellent? Like, what should I not be putting on?
There are some oils that people like to use.
That's stuff from Avon, right?
Yeah, Avon Skin So Soft. I will say the oils, they're going to cause some effect because they're going to be thick. But as far as things that are tested to be safe and accurate and approved, you want to go for those products that have active ingredients of DEET, oil of lemon eucalyptus, and picaridin.
When I was growing up, my mom used to slather me with that Skin So Soft, and I was just like, I smelled really good, but I was really slimy, and I never thought it really worked. Are some people more prone to getting bit by mosquitoes?
So mosquitoes are attracted to your body heat, your smell, and your breath. So earlier we were trying to get some footage of the mosquitoes that I have in this trap here, and we were trying to get them real antsed up. So I started breathing on them, and then they got real excited. Mosquitoes can find you using those senses, and then that's how they find their blood meal. And it's only female mosquitoes that bite you.
Oh, see, there's more facts. I did not know that.
Yeah, that's pretty wild. And that's like your traps are, you have a whole, I've been over there a couple times, you have a whole plethora of traps. Some of them you use dry ice in them, right?
Yeah, so we use a variety of traps to attract mosquitoes using different lures or dry ice or lights to get them attracted to our traps so we can monitor the populations.
Wait, so do you just trap all the females, let all the guys go because they don't bite? Like, what is that?
Some males do come into the trap because they're chasing the females, but it's predominantly females that are going to be in the trap.
Okay, this is a family show, so we're going to take a step back and let's talk about tires.
Yes, so while you're out there looking around your yard for standing water, you might come upon a stack of tires that you said way back when that you were going to get rid of, and then you put them in the side of the house or covered them up with a tarp and forgot about them. Now is the time you can get rid of those tires for free and reduce mosquito habitats in your yard.
That's win-win.
It's going to be Saturday, October 14th at the Daytona International Speedway, Lot 4, and it's going to be from 8 a.m. to 2 p.m. You can follow us on Facebook. We have all the event pages on there, and on our website, volusia.org/mosquito. But come bring up to 20 tires to dispose of for free. They can have rims or no rims. They can be golf cart tires, bike tires, truck tires, tractor tires. I don't care what kind of tires they are. They could potentially be breeding mosquitoes. Bring them to us, and we'll take care of them for you.
Even if you see them on the side of the road, pick them up and bring them on down, right?
Yeah, David was at an event with us, and he actually went into the woods with us to collect tires one tire day.
Is that true?
Yeah, it's true, and it's going to be free.
That's. Do you have any partners in that event?
Yes. So sitting next to me, Benjamin Youngs, we're collaborating on this tire day to protect public health in Volusia County. We want to reduce tires in the community. This is a great time to do it as we're getting into the winter months. This is one of our source reduction activities of our integrated pest management plan is to reduce mosquito habitats as much as possible.
Okay. We are winding down the show. I have so many more questions. Will you guys please come back, the two of you? I've got a lot of questions about mosquitoes. Any other special events you guys do throughout the year we need to tell people about?
We do a lot of educational events. We do have a full-time education outreach coordinator. If you want to request an educational program for your club, 4-H club, Boy Scouts, Girl Scouts, for your classroom, if you want a scientific-based presentation for your students, we can do that. Contact us and we'll schedule a program for you.
Okay. Do you bring the mosquito sock, that scary thing?
We bring live mosquitoes to those presentations. We talk to everyone about the life cycle and how a mosquito grows, and then how integrated pest management can impact the growth of a mosquito and stop them from turning into biting adults.
Okay. Not that I would necessarily want to do this, but do you guys do tours of your facility?
We have hosted some groups, educational groups. It would be by request.
Okay. I've had Dave mentioned it earlier. The science behind what you do really is amazing, and I've had the privilege of touring it before and learning. I walked out with a whole different understanding of how much work the mosquito control district puts in. The Department of Health too. I'm not to dismiss you guys.
It's okay.
But how much?
A ton of credit.
The Department of Health does get a whole lot of the limelight. Where mosquito control district, like Dave said, you guys kind of operate sometimes very quietly off the radar and at 3 a.m. and stuff. So as we're going to wind down the show, thank you both very much for being here, and please come back sometime soon in the future.
Anytime.
Thank you.
No, I'm being told I have to carry it another 35 seconds.
I got one ending message. If you're visiting the beach this weekend, make sure to swim in front of a staff lifeguard tower. Stay in waist-deep water where you can firmly grasp the ground. Download the Volusia Beaches app and enjoy yourself. It's going to be a beautiful weekend. The weather's supposed to drop down at night. It might be time to get some firewood and just enjoy Volusia County.
And even though the temperatures are dropping, mosquitoes will still be active.
Put on your mosquito repellent.
Still wear your mosquito repellent and still check for that standing water around your house.
EPA approved.
EPA approved repellents, oil of lemon eucalyptus, and picardin.
And with that, we're out.
If you have a comment about Volusia Today, or if there is a topic you would like to hear featured, please contact Volusia County Community Information at